Welcome in. Thanks for checking us out. This is the Premier Mindset by Premier Performance LLC. I'm your host, Trent Mailer, LCSW, and this is episode 10. There's a bunch of information in the show notes of all these podcast episodes, whether it's just things we're going over, things we're talking about, along with where to find pictures of things that we're talking about in these episodes so you guys can look at the actual graphics. There's also videos of these episodes on Spotify and YouTube if you want to check it out and follow along that way. And I also share clips on social media, so you can find these in a lot of different places. The podcast itself is available, wherever you're listening to it right now, whether that be YouTube, Spotify, Apple Podcasts, and elsewhere. If there's somewhere you want it that it isn't, let me know and I can get it up there too. Please leave us a review. That always helps. Like us, follow us, favorite us, subscribe us. You want to make sure to get all this content as it's coming out. I want you guys being aware of it and getting the alerts as these things are coming. So be sure to follow along and check these things out. With this stuff, it's not a replacement for therapy or medical treatment if that's what's needed. It's purely educational. I just want to really expose this stuff of what we can do and how we can help ourselves, along with increasing awareness of just some of these things and what's going on, so we can take care of stuff in different ways and get the help we need and just live our life to the fullest. So don't be afraid to go get what you need. If you need these things, go get them. If you're not sure what you need, you can always ask me a question. I'd love to help however I can. Don't be afraid to reach out. I make it a point to give you guys actionable tools to find success in your life, and it's all evidence-based. These aren't just random things I'm just throwing at the wall to see if it works or not. I'm giving you these things because I know they work. I've seen them work, and they're backed by science, backed by research. So I want to give it to you guys. I want to let you guys know what you can do to just make things easier in your life, because life is hard enough, and we need to do some things to just make things easier, and this is the way to do it. If you do have any questions, concerns, anything that you want me to cover or get into more, feel free to reach out. There's a lot of ways to do that. The first way you could is through an email, which is tmailer@premierperformancereno.com. My last name spelled Mahler. You could text or call me directly at 775-561-0056. You could reach out on Instagram at premier_performance_Reno. You could also follow along on our TikTok, premier_performance_Reno. We also have our Facebook page and our LinkedIn page, Premier Performance LLC. So check us out, follow us on these pages, subscribe to us, favorite us, all this good stuff, just so you make sure to see these things. And, follow along as we give out more stuff each and every week, because this podcast is going to come out every Sunday and just kind of set you guys up for success in your week, whether you want to give it a shot on that Sunday as you prepare or at some point through your week. Today, what we're going to cover is drugs and addiction. We're not going to get into everything with it. It's a huge topic. There's no way we could get into all of it in just this little time frame of about an hour. But we're still going to do the best we can and cover a lot of things to give you guys a good idea and some ways to go into it deeper. And in the future, we will go into more episodes of this stuff. So if there are parts of it you want to see more of, or if you're interested in, feel free to let me know so I can make sure to cover those, especially a little more sooner too, if there is a desire to hear those. But first, let's jump into our brain activity to really get started. This one comes from Dr. Gabor Mate, who is pretty big in this field in general. He's a doctor that did a lot of work with addiction and trauma. He has some really great things, some books out and all this good stuff. If you guys want to look into him more. But this is an idea. This is an exercise that he has. I don't know if he came up with it, but it's one he uses and it's one he talks about. And it's a good one to kind of start getting into this, because a lot of what we'll see with drugs and addiction is this consistent pattern of avoidance and not feeling certain things. So this exercise is called the bear attention exercise. And with this exercise, we want to really feel the things that our body is feeling. We really want to feel the situations that we're in. We really want to experience things and not avoid things and really look at it objectively. So the goal is to observe our emotions very objectively, just looking at how it feels. Like I feel a tightness in my chest, or it feels like my throat is closing up, or it feels like I have a headache or tension in my arms, whatever it is. Just notice the feelings, the sensations that go with it. Notice the thoughts that are coming into our head. Don't judge them. Don't think about them. Don't think about what they mean. Just notice them. Like, that's an interesting thought. Certain events that are happening, whether it's situations that are going on, we just want to recognize it for what it is. Just look at the factual aspects of it. Don't give it the emotion of how I feel about it. Just really look at these things. Facts of a different situation, looking at these things again. And this is a way to really figure out and see how we're responding to certain things and when we're responding to things that aren't actually happening versus when we're responding to things that we're bringing into it. This is really helpful when we do have some sort of trauma, if we do have something that's triggering us. Because in that, if we are understanding where this stuff is coming from and we understand what's triggering it and what's happening, we can do some stuff about it. Again, recognition is that first step. So we want to just notice things. I know that sounds really simple, but it can actually be pretty tough, especially if you're not used to doing these things. So try to do it. Try and do it for like a week. Just see how it feels. You might really learn some stuff about yourself. You might hate it. You might love it. You might actually really enjoy doing it. It's kind of a different way to practice mindfulness, really just observing these things. But the key is just being non-judgmental with all of it. You can't judge it. You can't say anything about it. You just got to look at it for what it is. Okay? So to give that a shot, see what you guys think. If it's helpful, awesome. If it's not, that's totally fine. We're always going to give you guys more stuff. And we're just going to keep on adding to that toolbox. Just take the tools you like and keep adding those to your collection. So to start with this stuff, what is a drug? A drug is a medicine or other substance which has a physiological effect when ingested or otherwise introduced in the body. It can be kind of everything. This is something like coffee, could be sugar, could be alcohol, it could be heroin, it could be cocaine. There's a lot of different things it could be. And with this stuff, I want to really emphasize the idea of trying to look at these things objectively, just like we're talking about in that bear attention exercise. We don't want to judge it. We don't want to start categorizing things as good or bad or anything else. They're just tools and things that make certain things happen. And I know that's going to be tough, especially if any of you guys have people in your life that have been touched by addiction or substance use in any tough and difficult way. There's going to probably be a reaction, and that's not bad. That's normal. That's going to be probably more common than not. But that's why I want to talk about this stuff, so we can maybe shift a little bit of how we're looking at it and look at it a little more differently to try and change how we handle addiction problems and also how we manage some of these issues in our society, because there may be ways that work a little better that we're not willing to try because of judgment, because of these things that we're putting out there. So just keep this in mind, that this is something that can be kind of a lot of different things. It's something we're putting into the body and it's changing things. It creates physiological effects in the body. Okay? What do drugs do? Drugs affect the body's central nervous system in various ways. They affect how a person thinks, feels, and behaves. The 7 main types are depressants, psychedelics, stimulants, pathogens, opioids, cannabinoids, and dissociatives. These things really impact that nervous system in a lot of different ways, and that connects back to some of the things we talked about with like EMDR and trying to do things to get stuff unstuck. That central nervous system is really a key part of mental health in general, and when these things do interact with that, it does change how we're feeling and what we're going through in that day. And especially if we're having a trauma response, that nervous system is getting activated. So using something like a depressant or any of these other things could really change how it feels and really change how our body's responding to it. So this is why we're using some of these things. This is why this stuff can be such a strong hold on us, is it's really helping the exact system that's having issues when we're struggling with mental health or things related to mental health. Drugs impact us in a lot of different ways. And there's some studies that kind of gone over this that I'm going to cover really quick. Perception but not expectation of reward is altered in people with cocaine addiction. So this study is really focusing on this idea that our perception of reward is all actually like altered and changed when we do get into a cocaine addiction. And this is the thing. The use of these drugs, like I'm talking about, is a lot of times avoidance of certain things. It's related to mental health in a lot of ways. But the second part of this is the actual chemical part. That once we get into things, it can start changing stuff in our brain. It can start changing how our body is functioning and what's working, which is why you get to the chemical dependency aspect of things, and things just change in that way. So there's kind of two sides to this, and we need to talk about both sides, because often we fall into the side of the chemical dependency and talking about that side, which is a huge part and that's important. But sometimes we miss the fact that we got to talk about some of the stuff before that to not have that getting in the way as much. Like trying to get stuff set up before we fall into things, before that chemical dependency really gets its grip. And I think we can pull some people out of this and have a different understanding of how to use substances in our life in general and just change that relationship. It's going to help out in a lot of different ways. So going back to the study, Researchers report that cocaine addiction disrupts the dopamine neurons that govern how we perceive and learn from rewards. Though people with cocaine addiction have similar expectations of rewards compared to controls being people in the study that aren't in the cocaine addiction, their dopamine neurons send out much weaker signals when these rewards are actually received. So it doesn't feel as good when they actually get it. This dysregulation could make it more difficult for people with cocaine addiction to learn from their experiences and change addictive behavior. You're not rewarded as much when you change things and do things differently. Um, so it gets to this point where sometimes we're seeking these things out, and that's a lot of it. Where if you're getting this rush from cocaine that you're not getting anywhere else, you might seek it out there. But the other side of this is also asking ourselves: is there a hole I'm trying to fill with this dopamine rush? Sometimes there is, sometimes there isn't. But that's a good question to ask ourselves. And again, it goes back to that recognition. We got to dive into these things and see what's actually going on, see what's happening. Another study talking about pregnancy and child rearing and all these kind of things that connect to addictions and how this stuff can get passed down. They showed that exposure to marijuana in the womb may increase the risk of addictions to opioids later in life. Researchers identify neurobiological changes leading to increased release of brain chemical dopamine and its target neurons linked to addictive like behavior. So the things that we're ingesting, even in the womb or even if we are pregnant with a child, can cause changes and set up people for these things later. It doesn't guarantee these things are going to happen. There's no guarantee with this stuff, it's all probability. But it is setting it up and making it more likely to happen, which is why we got to be really careful in these very vulnerable spots in life. Another study talked about how cannabis use during pregnancy can impact thinking, learning skills, increase aggression among children. And I know there's a lot of talk out there about different substances and using them while pregnant. It's pretty broad in how it's talked about, which is good. I just want to cover it really quickly and just really show that this stuff can have impacts, especially with the increase of just use of cannabis in our society nowadays. You know, it's a tool just like anything, but the way you use it, when you use it, can cause problems. And keeping these things in mind, that using that during pregnancy can cause some issues for children as they're being raised and as they're growing up in their life too. So just keep that in mind. There are some good things and bad things about drugs, and I want to cover kind of both and talk about that because I think sometimes we like to really harp on the cons of it. I think a lot of people know that, and I'm going to cover that too. But I think we also got to be honest with ourselves to talk about the pros of these things and how these things can help in different ways. Because some people do really get stuff from this, and if we're not even talking about that, how are we going to get them to listen to the sides of how it could go bad too? We got to look at both sides of it. We got to look at the whole picture. So we'll start off with the pros. We'll jump into some cons, and then we'll go in from there. With the pros of drugs, one thing that really helps that comes from it, the thing that really traps a lot of people, is short-term relief. Being drunk or high does make it easier than dealing with a problem right there in that moment. It doesn't mean there won't be a whole bunch more problems later. It doesn't mean that problem won't get worse. And that's typically what happens, which is why we keep using to keep getting the short-term relief. But in that moment, at that time, if we just freeze frame that moment, it is easier in that moment to be drunk or high than to deal with the problem. Problem is, it doesn't work long term. And this is what you'll see with a lot of substance use. It's usually short term things that are a little more on the pro side, and a lot of the long term things are more on the con side. There can be some short term things that are on the cons and vice versa, but this is something big to think about, that relief is powerful. That's why people get stuck on this stuff. But we also have to understand that it's short term and it's not going to last, and it's going to probably lead to more things later too. Another thing it can do, because we're talking about all drugs in general, is some drugs can change perception, can change thinking, can change, feelings of consciousness in different ways, just kind of exploring consciousness. This kind of goes back to more of things a little more related to like disassociatives or psychedelics like ketamine, um, psychedelic mushrooms, LSD, marijuana, all this kind of stuff. They can change these things. It can change how we're looking at things. It can change how we're thinking about things. It can alter these perceptions. That can be helpful sometimes. Some artists like to do this. They like to, use a substance and then look at an art piece or maybe explore an idea a little differently. And it has led to some interesting things. There's some art out there where you can see people doing art and different drugs. And it does change how the art comes out and what it looks like. So that is something that does happen. It's not saying by any means that you need drugs to be an artist. It's just that is something that does happen from time to time. I mean, there's stories of Stephen King when he was writing a lot of his books that he had a big cocaine habit at that time too. And again, you don't need drugs to be great. I'm not saying that by any means. I'm just saying this is something that has happened. This is something that people have taken advantage of, whether that be leaning on it and kind of making an excuse of this is why I want to use this thing, or whether this is actually how they're using it and they're experimenting and exploring things in different ways. It's all about how we use things. We got to be very careful with this stuff. So keep that in mind. That's another thing that can come from this stuff. Another thing is distraction, kind of like that short term relief. You're kind of distracted from other things. If you don't have anything to do, it can distract you from the boredom. You'll see addiction rates kind of skyrocket in towns where there's not much to do. You've seen this as well in different science experiments that people talk about. They have one with a rat with drugs where they have like an opioid in the cage with them, and they press this lever and they get the opioid. And they showed that they just keep doing it and they keep increasing that behavior, just keep getting more and more of it. So it kind of paints this picture that addiction is something that's just going to happen, that you have access to it, then you're going to just want more and more and more. But there's another study that came out kind of not refuting it, but really giving it context. And this study is called Rat Park. And in this study, what they had is they created a park for rats, essentially, where there was a bunch of things you could do. There's a bunch of activities. There's other rats, all this kind of stuff. And they also still had the opioid in the system. The rat would still use the opioid, but it was much less, and it didn't hit rates of like addiction or problems, and never really got close to overdose as well. Because what they found success in was the rat's ability to distract and do all these other things. So if we have nothing to do, sometimes it does push us to using substances because we have nothing to do. This is kind of an argument for certain towns to just do more things best we can, to find ways to get busy, get hobbies, all this stuff. If we have nothing going on, it's just easier to fall into this stuff. That's, another side of it. It can be fun short term. So again, if I'm super bored and I don't have anything to do, like if it's five friends hanging out that have anything to do, it makes sense that at some point they might use a substance to try and have fun doing nothing. So giving people things to do, getting people into things can really help out. And that's something to keep in mind with, raising kids too. It's just giving them things to do, keeping them busy is going to probably help keep them away from things that, we don't really want them doing because it might be harmful for them. And you'll see there's a lot of research out there of using these things too early. It can cause a lot of problems, whether we're talking about any of these drugs. Another pro that comes with drugs is that peer pressure feeling of feeling like you're fitting in with the group or fitting in with the tribe. That can really mess with us, and that can be something that bothers us, but that can also be something that feels kind of comforting of I'm fitting in and I'm like a part of this. So we got to be careful with that because that feels good, but again, that's more of a short-term thing and it's kind of hollow. It's not is it doesn't have as much depth to it as we really want it to. And that is a way to kind of fall into this stuff and get a little more stuck into it too. So it's kind of a pro and a con at the same time. So keep that in mind. That is something that can get stuck on this stuff. It can be easy to fall into. We just want to try and avoid that and try and do the things we want to do and create those, real lasting relationships that aren't stuck in terms of feeling like you need to fit in, even though that is a very basic evolutionary thing that we all have. Jumping into the cons of drugs, there's a lot of different things in there. First one is withdrawal, that chemical dependency piece, that feeling of just how terrible it is if you're trying to stop these things. Some of this stuff can be really hard. That's why there are a lot of places for detoxing because you actually need like medical supervision and treatment and stuff while you're going through it because of how intense it can be, and sometimes you need help with it. It's hard. And this is another reason not to get too caught up in it is if you're too caught up in it, you kind of have to keep going forever until you stop, because if you stop, the withdrawal is going to hit you. And that can be pretty intense, especially for alcohol. Alcohol is the only drug out there that if you try and cut it cold turkey, it can actually kill you. So you have to really titrate it down, and that's why it's always good to do it with medical supervision, just to make sure you're not getting into like a dangerous territory. It's not about willpower sometimes, it's about like body chemistry and trying to take care of yourself and put yourself in a spot where you can get through these things. Another thing is embarrassment. There tends to be a lot of shame and embarrassment that comes into using, opening up about using, how you feel after it's gone, after the high or the drunk wears off, like that next day. Things that we do in the moment. I mean, how many of you have gone out drinking, drank too much, and then woke up the next day feeling bad, hungover, the withdrawal, also feeling, just embarrassed about what you did or how you acted or what you said, and, trying to hope you remember everything. Like, it can make a lot of things feel pretty bad. And I mean, that might be a reason to start using again right there in the moment, try and forget about it, not think about it. I mean, how many people start their day the next day just trying to have a beer or something to cool it over and, get rid of that hangover? And sometimes it does help, but sometimes you're just getting right back into that cycle, and it's very easy to fall into it full term. Another thing is it's feeling like wearing a mask, like we talked about, that kind of fitting in with the group. It feels good to feel like you're fitting in, but if you're doing these things just because other people are wanting to do things and you want to fit in, it feels like you're wearing a mask. You can feel that difference if you're not being genuine, you're not being yourself, and it doesn't feel good. It leads to problems, it leads to issues. So we want to just be ourselves. We wanted to build these deep relationships with people based on who we are, not what we're willing to do. And it's real easy to get caught up with trying to do the same things and do these stuff the same ways, but we want to help ourselves be us and be genuine with the people in our life, and the right people will be there. And I know it's scary worrying about people leaving and what they might do if they reject us, but we got to just let ourselves be genuine. There's a lot of shame in doing this stuff, especially if we get into things that are seen as a little more societally like unacceptable, or if they're causing bigger problems. We got the shame of doing it. We feel like we don't have control. We feel like we can't handle it. We don't want people to find out. We're trying to hide it, feeling powerless, feeling like I can't beat this thing. This stuff can just break us down, and it can really create some really dark days. This is why we need to reach out and lean on people. This is why we need to accept the difficulty of this stuff, because if we try and fight it on our own all the time, it just gets harder. And when that pain shows up, the thing is, we're teaching ourselves to deal with it through the substance. So you're just going to dive right back into it again, and we just keep creating it. We just keep this cycle going. It can also make people more susceptible to mental health disorders or medical disorders. Substance use can lead to medical problems. It can also lead to mental health problems. It can create more issues. Sometimes substance use is self-medication, like people are trying to medicate themselves for issues they have going on. You see that a lot with stimulants. When people have ADHD, they'll try and use stimulants to kind of self-medicate through these things. You'll see that a lot with like meth, but it doesn't work, and we got to do it the right way. And if we're not doing it the right way, we can cause issues in our brain, just like we were talking about earlier with that study on the cocaine and how it disrupts the reward system. We use these things enough, it does start to change things, and that's why we got to be careful of it. We can't get too caught into it. The deeper we get into it, the harder it is to get out of it. Another research study kind of dove into this a little bit, that studies show that young adults at risk for psychosis showed reduced brain connectivity, a deficit that cannabis use appears to worsen, a new study has found. So again, it's going back to that idea that using these things at a young age, our brain's not ready for it, and it can cause problems. It's still developing. It's still trying to prune neurons and all these things to just, develop as we need to. So we got to let our body develop the right way. We got to give it that time. But it's also saying that if we use this stuff, it can create changes in the brain that can set us up for, future issues. This is something we got to be careful of, especially if you are predisposed to psychosis in your family. If that's there, if that piece is there, you can trigger it with cannabis use. You got to be very careful. It's not necessarily you're going to create it if it was never there. If there's no family history of it at all, there's a pretty good chance you're not going to create it. But especially if that's there in your background, you got to be very careful with it. The breakthrough of this study paves the way for psychosis treatment by targeting current symptoms that current medications miss. Going deeper into this, the author of the study talks about not every cannabis user will develop psychosis, but for some, the risks are high, and our research helps clarify why. It goes back to that reduced brain connectivity that appears to create more problems. Cannabis appears to disrupt the brain's natural process of refining and pruning synapses, which is essential for healthy brain development. That's from Dr. Romini Mizrahi from McGill's Department of Psychiatry. And this is why we got to focus on this stuff, because if we're not aware of what this is doing, it's going to do stuff in the background that's going to cause problems for us later. And cannabis, again, is a one that we like to talk about sometimes because there's a lot of positives and it is relatively safe in a lot of ways. But if we use this at the wrong time, especially if we use it too young, it can cause problems, and we do have to be aware of that reality. With substance use in general, it connects a lot to those band-aid solutions I talk about a lot. It's a short-term thing. That's what I mean by a band-aid solution. It's just a short-term solution, a short-term relief. My warning in general about substance use is don't drink or use when you are sad, anxious, lonely, worried, or in any negative feeling state. These are times when you should figure out healthy ways of coping, using healthy coping strategies, skills that we've talked about, leaning on friends, that kind of stuff. If you drink or use during these times, you are at a high risk for using your drinking or use as a crutch. The more you do that, the more you set yourself up for doing that long term and continuing that, creating a pattern. And then we get stuck. Then we get into the loop of chemical dependency and all this other stuff. So we want to deal with those things. If you're feeling those negative feeling states, deal with them and just face them, embrace them, use the coping strategies we're going over, use the skills, deal with them. Use the substance or the drink later, after that's gone. It's not saying you can't ever use these things, but if we use it as a crutch and we use it at the wrong time, it will get worse. It will cause more problems. Another study going back to this talks about how things we go through in the past can set us up for this. And it's going back to that idea of that nervous system and how trauma gets stuck in there and it causes responses and stress responses that maybe our body wants to react to through avoidance. So, to our knowledge, this is the first study to link childhood trauma with the effects of opioids in people without histories of addiction, suggesting that childhood trauma may lead to a greater sensitivity to the positive and pleasurable effects of opioids. This may explain the link between childhood trauma and vulnerability to opioid use disorder, with implications for treatments and prescribing of opioids medically. One possible explanation for the differing responses to morphine is that childhood trauma affects the development of the endogenous opioid system, a pain-relieving system that is sensitive to chemicals including endorphins, our natural opioids. When a baby cries and is comforted, endorphins are released. So if loving interactions like this don't happen, this system may develop differently and could become more sensitive to the rewarding effects of opioid drugs. This is why there's a saying out there of heroin or opioids can feel like that warm, loving hug that you never got. Because this is the system it's interacting with. It's interacting with the system that gets activated when we do get that warm, loving hug from, a parent. So if we do have that background of childhood trauma, it sets us up to be susceptible to this opioid trying to fill that gap and give us that feeling, which is why that grip can be so strong. And this, when combined with like the shame of rejection and trying to hide stuff and like others being disappointed, can further cause this cycle to run because we're feeling that void even more. We're feeling that pain of, just rejection. So we go get that warm, loving hug from the opioid again, and then we just keep going. We keep building that cycle up. And then we get so deep into it, we can't stop because of the chemical dependency due to the intense withdrawal that we keep using out of like survival now. So it's a really nasty cycle, which is why it's so hard to get out of sometimes. And this is why we got to understand it for what it is and try and stop it before it starts. And this is why I want to put this out there and I talk about it so much, because I want people to understand how this works as they're getting into just being introduced to substances in general in their life. Because if we use it in a responsible, healthy way, chances are it won't lead to that, problem state or addiction creation that's going to really start causing a lot of those problems. If we don't take care of the issues underneath, it can lead to continuous dependency. Whether that be dependency on other things, there's other addictions out there like behavioral addictions, whether that's porn or the gym or, work or, whatever it is. There's anything that you can get addicted to. It's just, what is it hiding you from? What are you avoiding with it? How is it being a band-aid for you? Often we're trying to treat a pain with the substance or, the behavior, whatever we're doing, whatever we're addicted to, which is why abstinence doesn't really work. Because if the pain is still there, we must deal with the hurt, whether it's present or past trauma. So that could be chronic pain. That's always connected to these things a lot. And the reason I say abstinence doesn't fully work is because we've tried it a lot of times and it hasn't fully worked on like a societal level. I'm not saying it won't work for you. Sometimes people do just cut things and are just done with it, and that's just it, and that's just what works for them. And that's great. That's not a bad thing. I'm saying on a societal level, when we preach abstinence and not doing things, it tends to not lead to the best of responses, because some people can just stop these things. Some people do have that control and that willpower. Some people, that pain that they've gone through is so intense that they're looking for anything possible to cover it up and hide it and run from it and get it gone. That idea of just don't do it is never going to really resonate. We got to give something else. Because if we don't have that willpower to hold into that void and just not do the thing, we need something else there to hold us and bridge us. So that could be like other skills, coping strategies that are working instead, facing these things and dealing with them, getting the trauma processed. All this kind of stuff can help a lot. But we just want to keep in mind that abstinence hasn't really been a great strategy, whether we're talking about various ways we've done it over the years. I mean, we tried it a lot with the DARE program, and it wasn't very successful at all. The just say no, it didn't really work. We need to get to the point of education and letting people know what these things are and how to deal with them, what to do about them, and that tends to work better. I mean, we saw that the most with safe sex. At one point, we did talk about just like, don't do it, don't do these things, just avoid it. You don't need to be doing it. But then a lot of people were doing things unsafely because they were trying to figure it out on their own in the background, and they were still doing it. So then we kind of shifted the conversation to learning how to do it safely and doing it the right way so it doesn't cause as many problems. And that tended to work a whole lot better because now people knew what to do if they were going to do it. And they still talked about the idea of waiting and abstinence is an option. You can't do these things. It's not that we have to choose one or the other. But if we try and hide this stuff, if we don't talk about it, if we don't shine a light on it, people try and figure it out on their own and they fall into traps that are avoidable. This is why I like to talk about it. And this is why I'm harping on both sides, both the deep, dark, grasp of addiction that can really get us stuck with the chemical dependency and all the things that get into it, but also just like those first time users that are exploring this stuff for the first time and knowing how to use it to not get stuck, not get trapped. We got to use these tools the right way. We can't use them in ways that are going to get us hurt. That's going to cause more problems, and I don't want to see that for anybody. So be aware of these times when you're using this stuff and just being careful of using it when we're using it as a crutch instead of just using it as maybe like an amplifier for a situation that we're in. Diving a little bit more into what addiction is now. Addiction is a chronic disease characterized by a compulsive substance use or engagement in behaviors despite harmful consequences. And it's often accompanied by physical, psychological, and social problems. It involves a loss of control, persistent urges, and a continued focus on the substance or activity despite attempts to quit or reduce use. So you're kind of stuck on this thing. It's giving you problems. It's not stopping. You can't stop. It's very compulsive, very impulsive. It's often accompanied by physical problems. You feel bad. Things feel bad. Psychological issues, going back to the mental health stuff we were talking about, social problems, issues within relationships, losing friendships, losing romantic relationships, losing jobs, loss of control, persistent urges. We're constantly thinking about it. It's on our mind all the time, and we try to stop. We try to reduce how much we're doing, and it just doesn't really happen. Andrew Huberman from the Huberman Lab talks about this when he goes into a conversation about dopamine, and he explained, if we look at it from a neurobiologist state of mind, that addiction is a progressive narrowing of the things that give you pleasure. So you're kind of shortening and closing in your world, and the only thing that's really giving you what you're looking for is that substance, is that behavior, whatever it is that you're kind of stuck on or using as that escape. And the more we kind of shut these things down, the more you see that you'll do anything to just focus on that, and that everything else falls off the edge. So we want to try and expand things. We want to expand how many different things give us pleasure. We don't want to narrow it. That's going to be that piece of addiction. Although there are many signs and symptoms and they're different for everybody, there's one that is common to all alcoholics and drug addicts, and that is a loss of control. Is that once we get into it, we just can't stop ourselves. We dive deep into it. We can't stop using it. It's just out of our control. It just has a hold of us. There is sometimes a need to hit rock bottom. And this isn't saying we got to let things fall apart and people's lives got to get terrible. But people have to hit this point where they look up and say, I need help or I'm doing something wrong. Because if they don't realize that, they're going to keep going. That's why there's a need for it. That's why we often see a rock bottom and then people get help. Because they realize, okay, this isn't working. I need to do something else. Denial is a huge part of it. A lot of people with that loss of control want to say they're still in control. So that's where the rock bottom piece comes in, is it helps people recognize that this isn't working and I need something else. This is why in the 12 Steps program, they have this aspect of powerlessness, because it's kind of that acceptance of, I can't control this, I can't handle this, I need help, I need something else to lean on, this isn't working. And especially if we're in the real dark grips of this stuff, we need to get ourselves out of that, and recognizing it's not working is kind of that first step. Recognition is always the first step. Shame is a huge part of this, and we want to really face it and confront it and try and get it gone and try and move that shame to guilt. Guilt's a whole lot easier to manage. Shame is really toxic. It really breaks us up. And this is where radical acceptance can come in. One of the distress tolerance skills we talked about in the past episodes. Radical acceptance is accepting reality as it is and trying not to judge it, trying not to beat ourselves up about it, but just accepting it. Shame causes a lot of problems, and sometimes it causes us to keep using. There was a study done where Owen Flanagan at Duke University talked about shame and its role in this. And he had some really great points that I want to cover with you guys really quick. He said, shame is not simply a feeling caused by being seen, naked as it were, by others. It also involves not passing one's own survey. Shame looks to what I am. Almost all addicts experience failures of basic aging capacities. For example, in the first criteria of the DSM-5, there's a failure to do what one reflectively intends. The not addict will get that the addict might fail if a drink or a drug is right in front of her. We relate from chocolate candy type experiences. But the addict will decide, indeed, she will resolve not to purchase alcohol or cocaine, and then find herself or themselves driving to the liquor store or the crack house. This is shameful and is experienced as such both on the way to score, although in something of a blur, and afterward, I am ashamed of who I am, not simply for what I did. And it builds. An addict is someone who, like everyone else, has an educational, career, and interpersonal aspirations, and he reliably fails to achieve them, or he's achieves them to some degree, and then his addiction undermines these accomplishments. Every alcoholic and every addict in rooms of AA and NA, and most every memoir of addiction, even if the author is not inoculated in the 12 steps way of speaking, will speak of extreme feelings of shame for who one is and who one has become in one's own eyes, even if one has not yet been fully seen by others, and even if objective failures are still in the not yet category. Addiction is not a synchronic disorder that ends with the end of taking one's drug of choice. It is a diachronic, molar person level disorder, as such requires psychological, epistemic, moral, and narrative healing and reconstruction. So I know it's very dense, but really what it's talking about is that shame is there for pretty much anyone with struggles in addiction. And it doesn't even have to be seen by other people, because that shame can come from ourselves. Maybe you've felt this before, where it's like, I want to eat healthy, and then you find yourself driving to like Taco Bell, and you feel that like guilt and shame kind of in your gut of like, I shouldn't be doing this. Why am I doing this? Why couldn't I just do this? Or like you wanted to wake up to work out and you just didn't. You just feel this shame and guilt of like, I should have just done it. Why didn't I do this? And you just kicked yourself all day long. That happens with, addictions and substance use in general, which is why it starts kind of compounding itself and creating this cycle. That's why this stuff is so hard, is it creates cycles all day long, and it's really easy to get stuck in them. It's really easy to get lost in them. There are a lot of different strategies to use instead of drugs, and these things are helpful because if we're using these things in the moment, you're going to handle things in much better ways and manage things in much better ways, and you're also not going to do things in an impulsive way. Coping strategies, skills, and motivation of individuals who recover from SUD, which is substance use disorder, may protect them from the onset of a new substance use disorder. In other words, by making the life-affirming transitions from addicted to recovered, we gain a recovery toolbox. That's the toolbox we're talking about. You just get a lot of things that work for you and you keep building up for yourself. That helps us navigate life's challenges and stresses in a much healthier way. We learn to connect with people, push our egos aside, and to ask for help if we need it. Thus, when faced with stressful situations that formerly would trigger us to drink or drug, we might respond by exercising or calling a friend rather than using a substance. As such, we substitute addictions with healthier activities that perform the function that the drink or drug used to, albeit in a much more fulfilling way. So our goal here is to really just change it up and use something else. Use a different coping strategy other than that short-term relief of the substance to feel better, and then keep going with our day. You might find that the desire to use the substance after that's actually just gone. You don't really want to, because most of the time that substance use is trying to cover up the pain. So if we take care of the pain, we don't need it anymore. With that, we really want to focus on the idea that there's a lot of other stuff we can do that does work, that can help us get through this. This isn't just one thing or nothing where we have to use the substances. And I hear a lot of that people are scared to try anything else because the substances have worked and they haven't found success with anything else. My plea to you is to try it. Just try other things. See what happens. If you try the things and it doesn't work, you can always use the substance right after. But try and use different, more healthier coping strategies and see if they work better. See if it changes things for you. You don't have to get stuck in this stuff. I know it's hard, but we just got to help ourselves get through them. The idea here is that alcohol serves to mediate feelings of numbing, dulling, or blocking them entirely. And when you reduce your use or even stop drinking, your feelings will come back. As this happens, it is often recommended that you keep a journal and that you talk to your friends, family, partner, or therapist about these thoughts and feelings. The reason for that is those things coming back up are things we haven't been listening to for a long time. If you go back to our emotions episode, you see that emotions are just our body trying to talk to us, and we've been trying to turn that off and not listen to it. So when it comes back, it can come back really loud, and it can come back with a vengeance, kind of. So we want to have people to lean on. We want to have things to lean on to help ourselves hear it out, because it will calm back down. It is not going to last at that really intense level. It's just intense because it's been turned off. But once it gets going, once it gets into its flow, it's going to start to calm down. It's going to hit a better spot. So one thing that we can use in this moment, if we're having a tough time, is the acronym HALT. Okay, HALT. What this does is it captures the idea of what could be causing our problem right now. And if we take care of those things, it might help us resist that urge of the substance. So HALT stands for hungry, angry, lonely, and tired. These are the types of feelings people will experience as they reduce their alcohol or drug use. And it reminds us to halt or stop and pay attention to what we need. Somehow we have to cope with those feelings or risk relapse. If you're hungry, then eat. Simple. If you're angry, then tell someone, vent, exercise, pound a pillow, express your anger in a healthy way. Write it on a note, light it on fire, right? Just doing these different things to kind of release that anger. It can take a little bit more work with anger. If you're lonely, then surround yourself with friends or start the process of finding new ones. Don't get so caught up if there's not really anybody there, because a lot of substance use is centered around isolation too. So getting out of this can be tough because it feels like there's no one there. So we want to go get people. We want to find more people, and there are ways to do it. And we will talk about that in future episodes too. But if you have questions or issues with that specifically, let me know and I can walk you through it or help you out individually. The last one is tired. If you're tired, go to sleep. Get a nap. Do a yoga nidra, do a meditation, whatever it is to kind of recharge and get what you need. Okay? If we can take care of HALT, there's a good chance we're not going to get ourselves to that point of wanting to use again. And it's not saying that use or the urge to use won't come up ever again. It's just saying it's going to reduce that risk of relapse and give us more control, because we're not going to be as impulsive. We're not trying to run from pain. We're not as vulnerable. It's building up that armor again. So try and take care of that stuff. There's a lot of other things you can do too, such as mindfulness. Mindfulness always helps out, which is why a couple of the things we already talked about today kind of base around mindfulness, like the bear attention exercise. You got distress tolerance. That's that radical acceptance. That's using TIP. It's using other skills to help us deal with the stress in the moment. Self-care, kind of like the stuff in HALT. If you're hungry, eat food. If you're tired, get some sleep. Taking care of our body, making sure we're good so we can do good things. We want to lean on supports. We want to lean on the people in our life, our support systems, the people that are there for us. We might need to make some more people. That's where AA, NA, all these things can help, is it's a great community to lean on. There's a lot of people there. There's a lot of structure there that you can lean on, so they can help out. But most importantly, do what works best and focus on your strengths. If something that's really helpful for you is like painting, then go paint. Do what works for you. Don't get caught up in trying some random skill that you've never done that doesn't work. You got to use the things that work for you. If you focus on your strengths, they've shown that that is more helpful than anything. That's not saying don't try other things. See if they work. See if they go anywhere for you. But don't leave out the stuff that actually works the best. Let's focus on those the most. Okay? So try and do those things, focus on your strengths, see where they go. Another big part of drugs that I want to talk about and get into, kind of shifting lens a little bit, is the legality of drugs and drug danger. The reason for this is I think it's important to talk about the safety and harm reduction of doing these things and trying to do things in safe ways if we're going to do it, kind of reducing that harm. Sometimes we're not going to stop this. Like in reality, having a world where no one uses substances is just probably never going to happen. But what we could do is kind of make people safer doing these things and maybe reduce the problems and issues we're seeing because of it and hopefully get people away from it a little sooner too. Substance use disorder treatment in the community is a superior alternative to incarceration for offenders with a substance misuse background, according to a recent study evaluating the effectiveness of the contract treatment sanction in Sweden. The risk of recidivism and adverse health events was lower during contract treatment than during the community sanction or probation. Providing treatment yields better results than punishment. Substance use, misuse, problems, and criminality often go hand in hand. So this study is really focused on that idea that punishing these things and just giving jail time or putting people on probation doesn't really help. What helps is treatment. And if we can look at this stuff as what it is, which is like an issue dealing with stress and problems, and we're running from it, having that avoidance, and it's leading to, medical issues, it's leading to mental health issues. If we can treat that stuff, if we can take care of that, if we can get rid of the pain, the substance use problems can stop and they just get managed better. If we have a substance use problem going on, it often does go hand in hand with criminality. You're robbing people to keep a habit up, burglarizing, you're doing things very impulsively in the moment because you're very vulnerable and you're very susceptible to impulsive action, like punching someone, whatever it is. So if we can treat these things and not just punish these things, it has shown in research in various countries all over the world, it just works better. 46% of prisoners in federal prison are there for drug-related crimes. 59% of all women sentenced to federal prison are serving time for drug offenses. 6,500 women are serving time for drug offenses. 45% of all men sentenced to federal prison are serving time for drug offenses. So those are huge populations in our prison that are there for substance use. And if we treat these things, if we can get into a different system that actually is treating these things, it will lead to things getting better. Our recidivism rates are crazy high in our prison system, which is how often people leave and come back, because once people are in these spots, they tend to get further traumatized. And if we have someone with a substance use issue already and they're in a place where they can get more traumatized, it's going to make that substance use issue worse. So we want to try and help people manage things in better ways, healthier ways, and more effective coping ways so that they don't have as many problems and things get easier. But if we just focus on that punishment, things will get harder. And there are certain things we do need to punish. I understand the need for the criminal justice system. I got my bachelor's degree in criminal justice. But it's just really highlighting this idea that the way we're handling substance use isn't really effective and it's not really working and it's making some problems worse. And we talk all the time about how many issues we have with drugs, the war on drugs, the opioid epidemic and all this stuff. But we just keep turning a blind eye of what the actual research is showing us, that we can make these things better, but the way we're doing it isn't working and we can't keep trying this way. We got to try something else. We got to try and do it different. Another thing I really want to say and I put out there is to test your drugs. If you're going to do it, make sure you know what you're taking. They've shown that the rates of overdose are much lower if you know what you're taking. A lot of times overdose happens because it's mixed with something or cut with something you don't know, and then you accidentally overdose. That happens at a much higher frequency. And that's another thing that we've seen in other countries where they have decriminalized drugs, is that overdose rates actually kind of drop. Because when people know what they're taking, the chance of that overdose is much less because people often aren't trying to overdose, they're trying to get away from pain. There are times people use this stuff to try and overdose and they're doing it purposely, like in suicide attempts. That is a thing. But again, if they know what they're taking, it just reduces the accident rate of this stuff. And that can cause a lot of problems, and we can do what we can with the suicidal ideation aspect of things. But the accidental overdose has been a tragic issue because you got people dying that don't want to die, and this is happening in ways that are kind of tearing families and societies apart. So test your drugs, make sure you know what you're taking. At the same time, we have to be safe with it. We want to be around people that are going to take care of us. We want to get medical help if we need medical help. This is why they've passed laws like the Good Samaritan law, where you can drop people off if they're overdosing or help people get the help they need and not get in trouble if you're using these things yourself, because they want people to get the help they need. We want to save people. We don't want people to die. We don't want people to run into problems and have issues. So test your stuff and make sure you know what you're doing and get people the help they need when they need it. Don't be afraid to go get these things and go get the treatment you need if you feel like you need that too. We got to be safe about it. We got to do these things the right way. There are a lot of other drugs out there, and there are some alternative uses to these things than just getting high. One thing that really comes out that I want to talk about with addiction is the psychedelic called ibogaine. There has been studies that have shown that ibogaine can help treat addiction and depression. So this is a psychedelic that can help us actually overcome some of these things and cause us to actually find some success. More reason to explore the use of this stuff, and that this stuff is all just tools. We just got to use it the right way and understand how we're using it ourselves. Recognition is the first step. Going into psychedelics, psychedelic drug therapy may address mental health concerns in people with cancer and addiction. Compared to patients receiving a placebo, those treated with psilocybin were found to be significantly less impulsive, depressed, and vulnerable than they were prior to the therapy. At the same time, these patients grew more open or more accepting of their thoughts and emotions. These changes were observed 7 months after participants received their second dose of psilocybin. So they're more open to things, and it lasted for a long period of time. And that, acceptance of thoughts and emotions goes back to that very objective, observing things and noticing them as they are. That's why we're talking a lot about this mindfulness, because this is where the solution lies. Since impulsiveness has long been linked to both excessive drinking and relapse after treatment, the personality changes brought about by psilocybin-assisted psychotherapy may help those recovering from alcohol dependence remain resilient to internal and external stressors known to trigger relapse, said study author Brock Pagny, PhD. Pagny is a postdoctoral fellow in the Department of Psychiatry at NYU Grossman School of Medicine. Psychedelics have really shown that they can help with this stuff. Again, we don't have access to using these things as much. It's still illegal as like a broad treatment. We're working on these things. We're trying to get things passed to open this up so we have access to using these medicines. I mean, here in Nevada, the Nevada Coalition of Psychedelic Medicines is working really hard to get things passed and moving forward so we can get this going. We can take advantage of these things. This isn't saying go do this stuff on your own, because that can be dangerous too. And again, this is purely educational. But I want you guys aware of how this next wave of treatment is coming, and that this stuff can really open doors and help things out. I don't want you guys afraid of it. And I kind of want to dip you guys into it before it really opens up, because I think it is going to change our society in some really positive ways. We just got to let ourselves get there. With a lot of this stuff, the reason the psychedelics cause such a beneficial change in some ways is because of what it's doing with our neurological pathways. It helps us reshape how our brain is forming these pathways through something called neuroplasticity. What this does is it changes those pathways and makes it easier to form new ones, which is changing our behaviors, changing our habits, changing our patterns. The more we do something, the more we have that pathway built into our brain. So if we want to change things, actually rewriting that, or changing that narrative, can help us change our life, which is why they're seeing this expansive change of using the psychedelics to increase the benefit of things, like that last study was talking about, 7 months afterwards. You're getting a lot more out of much less because of the impact of it. It's just making things like stick more. So psychedelics are, again, a tool, but if we use it the right way with therapy from a trained professional that is trained with psychedelics, we can find a lot of benefit to really nailing down ideas that might have been hard to do otherwise, or they might have taken a whole lot longer to get to otherwise. So I'll get more into this stuff in the future, but I just like throwing those things out there every once in a while, that there is some good stuff out there. There are some new things out there, and there are some things that we're trying to change in the field to help get access to more medications and more medicines that might help make these things last and help connect the mental health field as well. Back to the idea of addiction. There's a couple things I want to talk about in terms of how to treat addiction. So we're going to go through a few different things of just like what you can do and how you can approach some of this. Some therapists believe in a family systems approach, and that interpersonal relationships need to be altered so that the family becomes an environment within which the person abusing substances can stop or decrease use and the needs of family members can be met. Family systems approaches have been developed out of a strong theoretical tradition, but don't always have robust evidence. It sometimes forgets trauma and the difficult impacts of the family system and just getting these things to change. Because sometimes we try and change these things, but it doesn't change how that person is coping or how they're handling things, and they may not stop. If we just stop all the stressors, that's great. Things might be okay, but it doesn't mean they're not gonna go right back to it the second the stressors come back. So there are some great things in reorienting that stuff a little bit, helping support, but usually we need other things at the same time too. Generally, substance abuse treatment has relied on confrontation more than family therapy has. For a long time within the substance abuse treatment community, it was believed that confronting clients and breaking through their defenses was necessary to overcoming denial. Some preliminary research has suggested that a confrontational approach is sometimes the least effective method for getting clients to change substance abuse behavior. So calling people out, putting them on the spot, doing like an intervention, these kind of things actually has been shown to be the least effective method of getting these things done. We have this saying as therapists that we try and do all the time, which is meet our clients where they're at, which is meet people where they are. And that's the same thing we want to do. People that are struggling with substance use disorder, they're going to have times they want help. The hard part is being available to help at that time, because chances are they're going to have done something to burn a bridge or hurt us. And that's where it's really tough. But if we can find a way to meet them at where they are at that time and help them out, you may find a way to pull them out of that trap. But if you try and force them out of that trap, they will get deeper and more stuck in that trap, and they'll double down on it. That's why that confrontation isn't super helpful, and that's why we want to be aware of it, that just calling people out and saying they're doing something isn't always the best way to go about it. The family of a client who has a substance use disorder can be expected to act differently and not always positively when the individual with a substance use disorder enters recovery. A family may react negatively to an individual member's cessation of substance use. Children may behave more aggressively or lie and steal to restabilize the family dynamic, or there may be a period of relative harmony that is disrupted when other problems that have been suppressed begin to surface. For example, family members may express resentment and anger more directly to the recovering person. If these other problems are not dealt with, the family's reactions may trigger relapse. Once that issue of that substance use is kind of more on the back burner, that we're into recovery or we're working on it, other things start to come up. Like, how dare you make me do all this for this last like 6 months or whatever it is. Or you start pointing fingers. It's really hard. And this is what I'm talking about when that person's ready for that help. We got to be willing to meet them where they are, because they probably have done something to hurt us or burn a bridge. If we hold on to that and we focus on that, that could trigger that relapse and push them back, because it's going to create that shame. They're going to feel really bad about it. And I'm not saying they shouldn't feel bad about it, but if you create that shame, they're going to try and deal with it the way they've always dealt with it, which is through the substance, and then we're right back to the start again. Sometimes we got to get better before we try and deal with the past. So if we can get through these things and try and work through this stuff, build up some really good coping strategies, and then eventually talk about that stuff later in a healthy, effective way, we could probably deal with it too. It's probably not going to create that relapse risk. But especially when it's fresh, we got to try and create this environment where we can kind of nurture healing and not get into a place of blaming and shaming, because that's just going to make things worse and get things more stuck again. One study concluded that for a number of reasons, those with substance use disorder avoid intimacy out of fear due to negative experiences of attachment to others. Going back to that opioid and that opioid system and not getting that warm, loving hug that you've always wanted and trying to get that through the drug. It is often said that the opposite of addiction is connection, and those struggling with substance use disorder are often lacking that sense of connection to others, especially because this is something that happens with an addiction, is we start to ruin a lot of connections. We burn bridges, we break friendships, we ruin relationships. So it's very easy to have isolation go hand in hand with addiction, and that's why it can also be the antidote and cure. And we got to surround ourselves with people, and we got to surround ourselves with community and love and heal, and then eventually get back to righting the wrongs of the past later. That's why in the 12 steps you do that later on. Alcohol abuse are often underpinned by maladaptive memories that link environmental stimuli, such as the sight or smell of an alcoholic beverage, with the feelings associated with the reward. For example, The new research in the field of neuroscience demonstrates that ketamine may help reduce addictive behaviors by interfering with the formation of maladaptive memories, effectively rewriting them. Again, that neuroplasticity, helping us looking at things differently, kind of getting rid of that pattern, that connection from the trigger or the stimuli that pushes us to wanting to use these things or get that reward from the use itself. There is no easy policy solution to reverse the epidemic of opioid dependence and mortality in the U.S. To resolve the opioid paradox, it is imperative to design policies to address the fundamental cause of overdose deaths, such as lack of economic opportunity, persistent physical and mental pain, and enhanced treatment for drug dependence and overdose rather than focusing on opioid analgesic agents as the cause of harm. We need to work and figure out ways to take care of the pain, whether it be a social pain of I don't have a job, I can't afford, food, persistent physical or mental pain where it's like chronic pain, lack of moving forward, being stuck, boredom, all this kind of stuff. And we got to deal with treatment with drug dependence and opioid overdose or just overdose in general to stop and have that harm reduction instead of just the shame and punishment of like you're using this thing, let's put you in a cage. So we got to really impact on these things and build this stuff up, and it's going to go further if we can get ourselves there. We want to work with a trained professional to find the root of whatever the problem is. That's the key to addiction is like what thing are we running from? What thing are we trying to cover the pain up from? Is it chronic pain? Is it a trauma from our past? Is it a childhood thing? Is it a lack of connection? Like what is it? And then work on using skills and strategies to manage the stress in life without resorting to the substance. Building up those coping strategies to handle things without needing to lean on the crutch of the substance use. Once you get the root gone, once you take care of that and process that, whatever that is, and once you show yourself you can manage stress in other ways, you'll see that you just don't lean on this stuff. You don't need it as much because it's not doing what you want it to do. It's not going to help you the way you need it to help. We want to take care of the stuff underneath. If we don't get to it, it leads to more problems. You got to do it with a trained professional, and we want to embrace and love those things, love those struggles. There's a documentary out there called Stutz on Netflix. It's about a psychiatrist and his work with people. There's some cool things in there. It's Jonah Hill that directs the documentary, and it's just kind of explaining his connection. And one thing they talk about in there is shadow work, which is the shadow side of us, the side of us that we feel shame about, that we wish wasn't there, that we don't want to admit is there, that we don't want to embrace. And that's sometimes where these issues come from underneath, and we got to embrace that part of us and love that part of us because it's a part of us too, even if we don't like it. And we forget that sometimes we like certain things of ourselves and we don't like other parts, and we want to distance ourselves from the parts we don't like, but it's a part of us too, and it feels that shame. So we got to accept ourselves, and if you're interested, go check that out and see what they're talking about. It can be pretty cool, and we'll probably talk about it a little more in the future too. But we got to embrace the things within ourselves that feel like flaws. We got to embrace who we are, all of us, and we just got to take care of these issues underneath. We can't let them just sit there. They're just going to cause more problems, more issues, and you're going to fall into traps you don't want to be in. Recognition is the first step. If we know this stuff's happening, we can do something about it. If we don't know what's happening, it's really hard. So we got to figure out what's going on. We got to recognize what's happening. If you have anybody in your life struggling with this stuff and you think they could get some benefit from learning about it or just exploring the idea or even talking to them about it, bring it up to them, have a conversation with them, see how they're feeling about it, see where they're at. If you want, you can even send them this episode and see if it helps out by them just hearing about it, and maybe something clicks, maybe it doesn't. But, the whole goal of me putting these episodes out is just to really expand that knowledge and awareness to people out there. So feel free to share this stuff and give it to someone you think is going to benefit from it, because that's the goal of this. It would be awesome if you guys could leave us a review and just let us know what you're thinking. Any feedback is really welcomed. I'd love to make things better. If there's things that you guys think could be better, if there's things that bother you, let me know and I'll try and work on it. And, if you just like it and it's giving you some good stuff, then feel free to give us a little shout out on that so other people can check it out too and realize that there might be some good things in here. We just want to stay connected any way we can. I really want to give you guys things that work and that help you in your life. So I'm giving you things that are useful, actionable tools you can use now. So try them out, see how they work. Don't just hear about them and then go on with your day. Actually give them a shot, see where they go. And let me know how it's going. I want to know. I want the updates. I want the success stories. I want to hear the struggles. I want to be there for you guys. I just want to be a resource. So keep me updated. Keep me in the awareness of just like how things are going, and just in the loop. I've talked to a couple of you guys about where you're at and what you've gotten from it and how it's been beneficial, and that's been awesome. It's really great to hear. And I just love staying connected. So feel free to reach out. Don't be shy. Even if you want to let me know about something, but you don't want to attach it to a name, send it anonymously. That's totally fine too. I just like hearing about it. So if you do want to reach out in any way, you can email me at tmailer@premierperformancereno.com. My last name is spelled Mahler. You could text or call me at 775-561-0056. We got our Instagram, premier_performance_Reno. We got our TikTok, premier_performance_Reno. We have our Facebook page and our LinkedIn page, Premier Performance LLC. So check us out, follow us, friend us, jump on all these things. Be aware of when new content's coming out. Feel free to reach out if you have any questions or if there's anything I can help with, or if you just want to let me know how it's going. Next week, we're going to get a little bit more into medication. This week, we talked about drugs in general. I'm going to get more into the medication side of things, of like prescription drugs, and not so much like we're using prescription drugs recreationally, but we're being prescribed drugs by a psychiatrist and how these things can work and what can we expect from these things. So I feel like there's a big knowledge gap on that. And the other thing is we're going to talk about ADHD because it kind of goes hand in hand with medication and how these things are working and just what this is. And it's been a hot topic lately where a lot of people are talking about it. So I figured we should get into it and talk about what it is, what it looks like, what we can do about it, and how to kind of channel it in a way that gives us a bunch of success. So you guys go do your thing, go have some fun, live your best life, optimize that performance, find that premier mindset, and just be the best you can be. If there's anything I can do, you let me know. And I hope to see you guys next week as we tune back in and just keep going. We're going to keep building on all this stuff and keep giving you guys a bunch of tools. And hopefully it's just making life easier. Be the best you can be. I hope you guys are having a good time. And I'll see you soon.